Devin Morgan here from CPC Physical Therapy. Today we're going to talk about a frequently seen and often performed exercise in physical therapy and chiropractic clinics. It's designed to strengthen your glutes, but often we don't know why we're doing things, and that kind of leads to us to discredit it a little bit, maybe not perform it as regularly as someone suggests for us. So today I'm going to give you justification as to why we do this exercise. The exercise to start is called side lying hip abduction. So, lying on your side, bending up your bottom leg, and simply lifting a straight leg towards the ceiling. This is prescribed to most people experiencing any lower extremity pathology, low back, or core pathology. It's a starter move, but it often gets overlooked, and people just generally don't enjoy it because many people are weak here. This exercise is important because it stabilizes your body through several motions. The first thing it can do for you is stabilize your squat pattern, and that will help to reduce knee, hip, and low back pain. So if someone has a weak glute med, which is a tiny muscle on the side of your hip, when they do a squat, their knees tend to waver inward a little bit. This puts a lot of undue stress on your ACL, and if you have osteoarthritis in your knees, it can really create a lot of pain for you in that motion. If you have a strong glute med and you go to perform a squat, it's much easier to keep your knees wide and tracking over your feet. This allows your hips to rotate properly, and also your lumbar spine to be more stabilized. The other thing it will do for you, if you're a person that has to use an assistive device, or if you have just issues going up and down stairs, the glute med is most important when we're standing on one leg. So if we perform this motion, that muscle has to fire to prevent me from dipping to the side. So if you ever see someone that's hips are dipping when they walk, you probably have a weak glute med. Strengthening that muscle would allow them to be more stable in this position. So there's a brief justification as to why that exercise is so important. If you're performing side-lying hip abduction at home and it generates pain in an area you haven't previously experienced, you may want to review this exercise with a skilled physical therapist. If you'd like to see one of our physical therapists at CPC Physical Therapy, call 303-GOT-PAIN.